Welcome, my dear students, to the discussion on brain autopsy part 1. This topic has been an enigma to the faculty and the postgraduates alike. And you shall see why. It is more like the wonder lamp that we are seeing on the screen. Yet, we shall try our best to unravel the mysteries of the brain. Before I plunge into the topic direct, it is my profound duty to thank the Grant Medical College, where I was posted as a postgraduate student, for the autopsy postings. And my special thanks to Professors Dr. Vagolikar and Dr. Lanjevar, who are stalwarts in this particular field. The aim of the autopsy of the brain is as follows. It is the same as a general medical autopsy. It helps in the diagnosis of neurological disorders. Sometimes it can help in the diagnosis of death and the underlying basic disease. Yet it shall be a part of completion, both as an autopsy as well as an examination exercise. Though we shall not be asked to do the exercise of autopsy of the brain, it will be definitely important from the examination point of view. And this is my own quotation. The beauty of confirming or confronting the clinical diagnosis lies in autopsy. You find that there is a panel of experts involved in it, namely the neurologist, the neurosurgeon, the radiologist, and the pathologist. This is one particular state where the pathologist can very yearningly lean forward to help from his collaterals elsewhere in other subjects. Before you start an autopsy procedure, of course, we are all familiar, but this is a recapitulation. What are the preliminary needs? There are some needs from outside, that is outside our own department, which means permission to do an autopsy. It can be either a coroner or a registrar, a consent form, the clinical notes, case sheets, and radiological picture, without which we shall never ever open the body. So this is important on one side. And the moment I start the autopsy, I cannot be searching for material. Hence, from within I need the jar for mounting the instruments for doing the autopsy, slides, syringes, needles, containers, fixatives, glutaraldehyde if I were to do something for an electron microscopy. And if I do have some research in mind, such as gene mapping, etc., appropriate necessities will have to be fulfilled. Now, what is the scope of CNS autopsy? All of us know that autopsies are nowadays being done. They are, of course, being restricted. But what we should remember is the brain. So, assessment of the brain alone is most important, whereas the others come as ancillaries, which include the spinal cord, the eyeball, skull as a whole, orbital cavities, pituitary, hypothalamus, the peripheral nerves and muscle also, had it been a case of dystrophy. This picture is not to give you a diagnosis, but to tell you to what extent the radiologist and that field can guide the pathologist. No longer does the final diagnosis depend on us alone. And here you are finding an MRI, a CT scan, a three-dimensional scan, etc., which will be throwing a lot of light on where exactly we should go. Now, students, after the necessary permission and all the necessary material that is needed for the procedure, we shall go into the procedure proper. I would like you people to kindly appreciate this autopsy table, room, as well as the wooden block. Courtesy, allow me. So this was the area that has provided us with many a knowledge. And obviously, the dead are teaching the living. A wooden block with this kind of a contour so that the neck lies in it and the head beyond that, so that it hangs a little bit. I would like you people to kindly appreciate the handsaw that is over here and the disorderliness of the autopsy table. But yet, this is where the dead have been teaching the living. Also, let us go on to the next list. What should be the position? What is the wooden block? And what are the types of incisions? I shall be dealing with all these, but of prime importance shall be the combing. Even when a person dies, he has to die in dignity. So also a corpse. You find that it has to be treated with dignity and given a decent burial. So the way we comb the hair before we put the incision also matters. The flaps, what do we do with the temporal muscle, the handsaw or the striker saw? These are all certain instruments which we shall be seeing. You and I stand on the foundation that has been laid by this for centuries. As I always mention, before we go into the job proper, we should be understanding the direction. So this is a skull in which you have got the various lobes. I am also relearning anatomy along with you. You have got the frontal, the parietal, and the occipital bones. There is a projection called the occipital condyle posteriorly. There is a process called the mastoid process, and these are the orbital ridges. These landmarks we should remember. The occipital condyle, mastoid process, orbital ridges. And this again is the X-ray of the same. What exactly should we do in an external examination? When I say external examination, it can be before opening the skull or before cutting the brain. We will have to look for fractures, hematoma, any of the infective exudate on the brain, evidence of bleeding or clotting, which can indicate a venous thrombus. The pituitary fossa will have to be examined. Paracellular region, the tumors such as a meningioma, as you find in this particular picture, thanks to Webpath, and also the blood vessels, if there is any abnormality. These are some that I am mentioning. For example, if it is going to be a comminuted fracture due to a head injury, obviously the conventional method might not be holding good, and it is the right and the privilege of the pathologist to change the mode of incision. We had already seen this. Anyway, it is for recapitulation and the further investigations if required. What will be needed is, you find that the comb has been used and there has been the hair that is split to different directions. And then there is more of a horizontal incision for the separation of the scalp. So this is one thing that we people should be maintaining. Look at, as though he is a plastic surgeon, he is acting. This goes beyond the or behind the earlobe so that it is not seen as much as possible. So that when finally after everything is over and it is sutured, the patient still looks decent. The procedure you people will have to explain. This is supposed to be a French procedure. As I mentioned earlier, after the combing, there has to be the reflection of the scalp, and it is used with some amount of force. One hand can be used for reflecting the scalp, whereas the other hand can be putting the holes through the chisel. There are different methods over here. This is called a French method, wherein it is more or less parallel. But what would be recommended will be have an angle of 120 degrees between the incisions. This means when the vault that you remove and the remaining of the skull are opposed to each other, they get locked. They are not displaced. Also, another method is the zigzag method, where an Z-shaped incision is put. And we should take care. I told you something about the orbital ridge. It should be 2 fingers above the orbital ridge that we start cutting the skull. The temporal flap. Of course, this is one of the muscles that is over here, which has to be released and again reflected, after which the skull is totally ours. Now, what are all these for? I would like you people to kindly identify. There are definite sets of instruments used for autopsy and the grossing of the brain. And these I would like you people to kindly identify. Each one has got a purpose. This is the long brain knife, which is as though it cuts through butter. And you find that there is a chisel, because obviously the skull will have to be broken through. And there is also a bit of a reflector over here, so that after we cut a little bit, we are able to reflect it so as to proceed. And this is a vibrator that can be used otherwise for the cutting instead of the routine handsaw. But the problem with it is we should be extremely careful. Therefore, there should be no damage to the underlying brain. Secondly, bone dust can be created. This can go into the nose and eyes of the pathologist as well as the others. In order to prevent this, it has been recommended that the entire area be encompassed with a plastic envelope and still the procedure be done. More important than that will be there can be infection because of slow viruses. And sometimes the patient might have been harboring a Creutzfeldt-Jakob disease. Such things should be borne in mind, and you please do understand the body is not a totally fixed in formalin, and it is a source of infection. Precautions will have to be maintained. And coming back to the bone dust, they say that a vacuum could be used so that it gets rid of all the debris that has been created. And this is McGraw-Gill. And you find that this is a wonderful source as such. This diagram is just to show that there are 2 layers of the skull. You have got 2 compact bones between which we have got the diplo or the spongy bone. There is an outer table and an inner table. The moment we start cutting the outer table and we reach the spongy bone, there will be a lack of resistance. At that point of time, we are supposed to be extremely careful. Because if we do proceed, we will go through the inner table and invariably damage the brain. This has to be definitely avoided. Not that the autopsy of the brain is something new. This has been age-old, thanks to ResearchGate for this wonderful picture. And you find that the way the skull has been cut. And after, as I told you people, there has been a cut, whether it is a zigzag method or it is a 120-degree method, the outer table or the upper part of the skull has been removed and then the brain has been exposed. Of course, it is covered with the matter, the dura mater and the arachnoid matter. So what happens is there has to be a deliberate incision and then it has been reflected. It can be done in the lateral side so that we find the brain parenchyma visible. If it is still adherent due to some reason, as shown here, there can be an incision that is put. This can happen in cases of exudates or in a case of meningitis. So look at this one. It has been done very beautifully. And this particular picture I will have to explain. So as it is being done, you people must remember the brain as such, it is weighing about 1.2 to 1.4 kg and it will definitely fall on its own weight. And even otherwise, there can be damage to the inner structures. As a result of which, as we do the procedure, if I am a right-hander, I will have to support the brain with my left hand and continue with the procedure. We must be thankful because there is enough space between the skull and the brain parenchyma. Therefore, there can be insinuation of the fingers that is possible. So once we reach deeper down, I should be able to delicately reflect and then remove the various structures, such as the optic nerves and ultimately the brainstem. I got a mnemonic for that for you people, which we shall be seeing. And finally, it is cut down as low as possible and the brain removed. So this is an important procedure which I would like you people to confidently explain. What is the mode of incision and what are the angles? Why do you use a zigzag method? And then how do you reflect the scalp? How do you reflect the meninges? And how do you arrive at the parenchyma? And finally, how you separate the brainstem. And this particular method, the bar method and the Bennett's method, you people can mention it is used for the fetal skull. In the fetus, you find that there is a lot of separation and therefore, obviously, the skull is not as firm as in the case of an adult. For a recapitulation, these are all the various methods of opening the skull. The French method, 120 degrees, zigzag method, bar, and the Bennett's method for the fetus. Now, this is a slide of a stupid mnemonic, which I like very much. We have seen the reflection of the dura mater. We have seen the underlying pathology, if any, such as a hematoma. The frontal lobe will have to be gently lifted. After which, what do we do? So, this is the mnemonic. The optic nerve is cut at its exit. Please remember, there is one pituitary which has to be cut at the stalk. There are two carotid arteries on both sides which have to be severed. This is followed by 3, 4, 5 cranial nerves. What then? So this is it. O is for the optic nerve, 1 pituitary, 2 pairs of carotid, 3, 4, 5 will be the cranial nerves, and rest will be easy to tell for maximum marks for the students. What does it mean? This is a repetition. Optic nerve, pituitary, carotid, and the cranial nerves. Rest means the other cranial nerves. T is for tell. Tentorium cerebelli, F and M, foramen magnum, at which site? U, S is for separating the stem. This I would like you people to kindly memorize so that it becomes easy for you to recollect and answer. The moment you people open the skull, what do? These are certain things that should be ready at hand, and you should do it. We must remember the CSF might be taken. With the help of a long needle, you will have to go into the ventricle and take the CSF for culture. Similarly, for biochemical investigations. If there is any kind of an exudate on the meninges, it is advised that you do not take a swab, but instead you take a small piece of it and then send it either for culture or for pathological investigations. No swab should be used. Similarly, brain parenchyma can be sampled for any of the DNA, RNA, or molecular studies. Cerebellum, we should be careful. In the region of the substantia nigra. So these are all certain things which can be affected by rabies. And hence, if you want to look for the negri bodies, these are sites which we should be having in mind. And small bits of tissue will have to be given for electron microscopy because it needs a rapid fixation, penetration, and thinner sections will have to be cut. Kindly identify this. And also this. So this is the conventional saw, and this is the vibrator that is being used for cutting the skull or any bone for that example. And here we come to the stage of the wonderful lamp. After having removed the precious brain, what do? So this question is invariably asked for you people. We will have to preserve it. There are two methods of doing it. One, directly immersing it in a fixative. Second one is perfusion through the vessels. They say that Once the blood is allowed to clot, it will be difficult to cut through it. Therefore, it has to be saline washed and then perfused. That is one mode of fixation. The second one is using a brain jar. This is a more conventional method, but nowadays it has been suggested that you people can use a large wide mouth bucket. Not a steel bucket, but a plastic bucket has been recommended since it is not corroded by the formalin. And the brain is suspended. We use the basilar artery or the vertebrobasilar artery through which a string is passed, and then it is tied onto the handle in a vertical position so that it is kept in suspension. This is because once it goes to the bottom, you find that the sulci and the gyri or the parenchyma are all very much affected. And secondly, you find that there won't be any penetration of the fixative at this surface. Therefore, there will be a rapid lysis. In order to prevent this and to allow the fixation from all sides, it has to be kept in suspension. This was being done by using the conventional brain jar. 20% formalin has been suggested by some books, whereas 10% formal saline by others. Complete immersion is needed, suspension, and on the top of it, there should be no cotton or gauze. Rather, you people will have to see that it is completely immersed. And the duration is 2 weeks, surprisingly. So this is what we should have in mind. This particular picture I had shown for the brain jar itself, though the stage or the direction of the fixation is not correct. But this is a beautiful brain jar which we can have in mind, and you people can order also if you become a neuropathologist. And this is again the vertebral artery and the basilar artery. This particular artery can act as a wonderful mode of support when the string is passed beneath it, and it can bear the entire weight of the brain. And this is a conventional jar that can be used. It is more by means of as any pot that has been used, an earthenware, as we say. So large plastic buckets as these have been recommended. The volume should be about 8 to 20 liters, 20% formalin. 10% formalin is used for periodical replacement because it is going to be there for a period of 2 weeks. The perfusion technique is another method. Here comes the MRI and the CT scan. And this itself is a computer-derived data. See how beautifully they are using it thanks to the computer. You find that these are all the areas. The sphenoid wing is over there. It is the base of the skull that I'm seeing from within. So there is an anterior cranial fossa, middle cranial fossa, and a posterior cranial fossa. There is a petrous pyramid. This is important. I'll tell you why. And then there will be a sella turcica in the region of the pituitary. Dorsum sellae is another one. And this, of course, is the foramen magnum. See how beautifully this has been depicted. I'm sure you people will be having this in mind. It is not difficult. You can always go back and study this. And why it is important to us? These areas. What he says is, sometimes the study can be extending into the orbital cavity, into the sphenoidal sinus, or even into the nasopharynx. So for all this, this has to be cut in this particular region which has been marked so that you study the structures from within. Sometimes there can be tumors which are called as a paracellular tumors, and these have been asked as questions for us. It is a confession by my own self, thanks to Benjamin Franklin. Life's tragedy is that we get too old too soon and wise too late. I am becoming very wise, but of course it is too late. I hope you people don't make this mistake. The normal anatomy, you people can just recollect. The weight is given here, the volume, and in women, you find that the weight is less. Not that they have got lesser amount of brain. Is it clear? So this is it. And this incidentally is the base of the brain that is covered with an exudate. So you people should be familiar with the various forms of meningitis, etc. That in my class of meningitis I had taken for undergraduates, which I would like you people very much to revisit. A basal exudate can be seen in some bacterial infection, particularly tuberculosis. What can we identify in this? And look at this one, it has been kept as a quiz or something for some branch of students. I hope you people are able to identify something. And it is it. So you are able to see the left ventricle, there is a foramen magnum, a third ventricle, aqueduct sylvius, and then the fourth ventricle. Of course, the cerebellum is over here, and this is the brainstem. See how much it is used, and this is the source of it. Pathology is not always ultimate. This is of paramount importance because removing the pituitary. All of us know how confusing the tumors of the pituitary can be, even with histological examination. So the cella turcica is removed, the pituitary being exposed and then removed at its stalk. And you find that it is not a rectangular mode of cut, but you find that it is more of a pentagonal mode of cut that is there. This is of paramount importance before we close the brain or the skull. And the importance of it, you people shall be seeing over here. So now that this is the brain parenchyma and then this is the lateral ventricle, etc., you find this is the brainstem and the cerebellum lying over here. But you find that the pituitary gland lies in a totally different location, from wherein you find that there is optic chiasma and then the optic nerves which can go to the eyeball. So this particular region can be of paramount importance in studying, provided the tumor is a retinoblastoma as a young patient and so on. Whatever be it, or it is a pituitary tumor. So this is of great importance. I want you people to kindly superimpose the parenchymal anatomy of the brain, the base of the skull, with the surrounding structures and the diagrams that I'm showing. This correlation is of great importance. So this again is what people look for in the surface. What we are seeing are the gyri. Gyri are the elevated regions and sulci are the depressions. There is a central sulcus over here and all are marked over here. I would like you people to see. One part of it, it is transparent and the meninges have not been reflected, whereas in another they have been completely removed for study. What do you see in this particular picture? Now that I have shown you the sulci and the gyri in the previous picture, what do you see in this sets of pictures? Obviously, I find that there is the widening of the sulci. That means there is an atrophy of the brain parenchyma, the gyri have become narrow. Also, I can appreciate the reduction in the size. This can happen in diseases such as Alzheimer's disease. Obviously, this is quite small. And so also a beautiful reflection in which I can find the widening of the sulci. Sometimes it can be located in one particular region. There is a frontal atrophy of the parenchyma alone. So this can be related to certain diseases which we people should be able to identify, relocate. It is not that we are able to make a diagnosis. Many a diagnosis is a post-biopsy or a post-histology wisdom. So it is atrophy. And another thing, I am only talking about the external surface, shall be hemorrhage. When I see a hemorrhagic brain, it can be traumatic, an accident, or a head injury, a forensic case itself. Or it can be a rupture from an aneurysm, aneurysm being the classical example. Hypertension and a rupture is well known. Disseminated intravascular coagulation all over the body, including the brain, and a hemorrhagic infarct. These are things that people should be having in mind. This particular order is fairly reasonable. So this is the ventricle with a hemorrhage, and this is the case of a subarachnoid hemorrhage. And look at this one. It is again thanks to web pathology. I have taken it. The patient had been having multiple aneurysms, sites of bifurcation of the blood vessels. So there is a rupture. The problem is the mode of treatment is totally different for any of these. In this particular case, if it is going to be because of hypertension, once the hypertension is controlled, you find that it gets sealed like a clot and it heals. Whereas in a case of a berry aneurysm, it is a congenital perennial weakness of the vessel wall. So there will be a bleeding and a repeated bleeding that will be there. So this will have to be diagnosed by means of an angiogram. And nowadays, this surgery is not being done by a neurosurgeon, but rather by the radiosurgeon himself. It is a superb thing that you people can read up about. And this is a radioangiogram that has diagnosed a berry aneurysm. Thanks to Wikipedia, these are again the sulci and the gyri. This is a medial picture that I have shown. So there is the cerebral hemisphere, the corpus callosum, the different parts of the brain. I would like you people to kindly appreciate. Just know the names, not beyond that for the time being. And the same thing has been shown in an X-ray or a CT scan or an MRI. For the sake of completion, we shall just touch upon the development of the brain. In the embryo, there is a region called the neural crest from which the brain develops. So this is a lateral view of it, and then this is the anteroposterior view. The brain has got 3 vesicles. So the topmost is called the prosencephalon or the forebrain, mesencephalon or the midbrain, and the rhobencephalon or the hindbrain, from which you find that there are the other derivatives. Finally, you get the cerebrum, the eye, the thalamus, hypothalamus, etc. that develop. You have got the midbrain in the middle, the pons and the cerebellum towards the end, and finally the medulla oblongata and even the spinal cord. This is how the brain develops. If you are not convinced, see a picture of it. A beautiful picture derived from one of the anatomy text, thanks to Wikipedia over here. So a cerebral hemisphere over here, and then there is a cerebellum. Finally, there is a medulla, the spinal cord. So I would like you people to kindly appreciate this development. Until now, we had seen what are all the prerequisites for doing an autopsy. How do you get a permission, etc. What are the surface markings as far as the skull and the brain are required? What are the methods of opening? What are the instruments that are required? Apart from that, what are all the other necessities, such as a culture bottle, etc. How do you remove the brain? Externally, what all do you see? It can be an inflammatory exudate or it can be a hematoma. Fixation of the brain, perfusion, fixation, etc. You people should know. What are the different views? Superior, lateral, sagittal, and then it can be the sulci and the gyri. What are all the various things that you people can diagnose? What is the development of the brain? And of course, I always finish with a quote. My best wishes to you, even though if it is belated. See you in brain